Companies that make prescription drugs say prices are high because they need money to invest in research and development. But is that really true? I asked John Rother for his take. He's president and CEO of the National Coalition on Healthcare.
Well, it may be partially true. R&D may account for about 20% of their budgets, but of course marketing, advertising accounts for much more. And many drug companies are also quite profitable, much more profitable than the rest of American industry. So I think there's plenty of room to have lower prices and still have the money they need to invest in research and development.
You live here in Washington, D.C., have all your entire life. It's always interesting whenever there's congressional investigations. I kind of liken it to Western movies. You know who's wearing the black hat and who's wearing the white hat. Last week, you see this brash executive pleading the fifth. Obviously, he's the black hat, the congressman with the white hat. But is it more complicated than that? Is it gray? I mean, what do we need to know as consumers?
You know, I do think that kind of sideshow is a distraction from the main issue. What we need to know as a consumer is that we don't have a very good way of keeping prices affordable, and we need to change laws in order to do that. So it's not just a matter of a black hat guy from Wall Street. It's really a matter of an entire industry that's not being forced to price by value. Instead, they price however they want. And that's just not sustainable over time.
John, you were at a meeting today where you were discussing how to make drugs more affordable. I imagine there's no real easy answer to that, but what are some of the things people were discussing?
Well, I think there is no one answer to it, but I think you could do things that would promote greater transparency so we would understand how prices get arrived at and what their real value is. We would do things to promote greater competition. So bringing competing drugs to market more quickly would help, as would doing things to kind of help us compare one drug to another. And then finally, we need to pay for performance or pay for results. Some drugs are simply going to be worth more than others because they actually offer cures, where most drugs, frankly, are just extending your period of illness for a time. So we should be paying more for the drugs that are really transformative and much less for drugs that are just marginal.
Comparisons, let's take it one step further. Let's not just compare the drugs, let's compare the United States with other countries. Yeah. As you know, prices here are very, very high. Why is that?
Well, it's because we don't do anything to keep prices reasonable. We let the industry charge whatever they want. No other country does that. In addition, we let drug companies market directly to consumers, and you see all the ads on TV and everywhere. No other country except New Zealand permits that either. So we have higher costs here, and we have no real restraints on prices. And as a result, we pay much, much more than any other country. And we need to do something about that. We cannot afford that if we're going to have a reasonable priced healthcare system.
And one thinks if we're paying more for those drugs, some of that money, you would assume, goes back to lobbying the members of Congress to make sure that the laws are not changed. How do you get around that?
Well, you know, that's true that the pharmaceutical industry has the largest lobbying force in Washington. They spend a lot to elect our representatives and a lot to keep them briefed every day. So I think it's really only public outrage that's going to be able to counteract that. We need people to stand up and say, hey, enough is enough. We need to change this. And we're seeing more and more people do that, particularly those now who are forced to pay thousands of dollars out of pocket for the drugs they need to get well, stay healthy. It's just not fair.
John Rother, thanks so much for your time.
My pleasure.